But I gotta get to work. Or we'll take you to work.
Oh my gosh.
That was a long time ago.
That was 33 years ago. Do you remember that? Oh my gosh. How did you remember me? I don't look the same.
I can remember that because Grandpa and I had to come over and get the car and drop it off over at Cleghorn.
Oh my gosh. Guys, it doesn't surprise me that I ran out of gas. I think I put that memory out of my brain. How many years did you live? 6. So about 6.5.
So what does that do?
He's IT, and I don't know the company that he works for, but he works from home. So,
Like, did you from home?
yes.
He's been working from home when they moved down here. I think he commuted back and forth and started working okay. After that started.
He's made a remarkable.
Yes.
Okay, I'd like to call this meeting of the Menomonie School District Board of Education to order. Jamie, would you take the roll, please?
Chris Freeman.
Here.
Mark Hillman.
Here.
Connie Bluesby.
Here.
Clint Moses.
Here.
Carl Palmer.
Here.
Amy Ritter Swanson.
Here.
Charlie Snyder.
Here.
Angie Skillings. Here. David Steyer.
Here. Thank you. We have a quorum to conduct business. We'll move on to item 1C. Before we do that, just to refresh everybody's memories for the rules for discussion that we adopted. Each board member will have 2 times to discuss any agenda item, up to 3 minutes each time. And unless we make a motion to suspend the rules, we will abide by those rules. Also, the superintendent is not a board member and therefore is not bound to those rules. Item 1C, agenda order, approval revision. Are there any items that anybody would like to change? Okay, moving on. Recommendations and accommodations. So, we have 2 that we're going to start with. I'd like to call Julie Figge forward, please. I missed you last 2 weeks ago. Before I do this, Julie and I went to kindergarten together. We went to grade school together, junior high, high school. We did FFA together. We did a demonstration on drinking milk and how important it was. True story. So our family's been a dear friend of our family. So the Board of Education of the School District of the Menomonie Area recognizes Julie Figge for her 26 years of dedicated service to the students, staff, and the Menomonie Area School District community. So thank you, Julie. Thank you. Okay, Cindy will pray. The Board of Education of the School District of the Menomonie Area recognizes Cindy Dupre for her 22 years of dedicated service to the student, staff, and the Menomonie Area School District community. So thank you. We appreciate everything you've done. I have 2 more, but they're up front. 2 other people that are retiring that could not be with us tonight. One is Renee Olson. The Board of Education of the School District of the Menomonie Area recognizes Renee Olson for her 20 years of dedicated service to the student, staff, and the Menomonie Area School District community. So congratulations to Renee. And our final one goes to Terry Staubbe. The Board of Education of the School District of the Menomonie Area recognizes Terry Staubbe for for her 18 years of dedicated service to the students, staff, and the Menomonie Area School District community. So congratulations, Terry. At this time, we'll move on to community communications. I would like to remind everyone that people that wish to speak to the board have 3 minutes. The comments of the people of the school district of Menomonie Area are encouraged and appreciated by the board and administrators. Education is a partnership with the schools, parents, and taxpayers, all being important participants. This is the time to air concerns and express your opinion on issues. There should be no negative personal attack against any individuals, including staff, board members, or administrators. Please indicate if you would like the board president to direct a member of the administration to respond to your concerns. So we'll start with Margaret Breich. You may take a seat at the table and use the mic there. And please state your name and address.
Press the button on the mic, I think, Margaret.
Needs to be blue.
The gray one.
No, the gray one.
Till the blue light comes
There
on.
you go. Thank
Okay,
you.
go ahead, Margaret.
I'm Margaret Reich at N6820 539th Street, Menomonie. I'm here to talk a little bit about Robert's Rules of Order. I don't believe anyone intentionally violates or misuses them, but they're very complicated. My book is over 700 pages, and that's why I compile a few things that I've done over the year into a document that you should all have now. So you have similar understandings of how things should be used. So if things are, well, I don't expect mistakes to be made, but this is confusing. One thing I put on here that I think is important concerning the intent of lay on the table. It says in here, in ordinary assemblies such as the school board, motion to lay on the table is out of order if it is evident to kill or avoid dealing with a measure. And I think sometimes issues are difficult, you don't want to talk about it, but to table it is not appropriate. I put in there the motions to postpone, because oftentimes when people make a motion to table, they really mean a motion to postpone. One thing complicated about this is when, in my book, sometimes talk about sessions and sometimes meetings. And so I put the definition of that, of a session, essentially it's the same as a meeting, because this organization meets at least quarterly. So when it comes to even postponing indefinitely, or just to postpone, at most you can do it to the next meeting, because the next meeting is the session. One thing I really liked, this was on the internet, not out of my book, about the motions to table. It says the chair can ask the maker of a motion to state his reason in order to establish the urgency and legitimate intent of the motion, or the maker can state it. I noticed later on you're going to have something on the board meeting protocols. I think that's something to consider, putting in there when you do that. The other thing I was concerned about was this 3 minutes. If you want a permanent rule, you need to have it in policy. It's by Robert's Rules of Order. You can override Robert's Rules of Order if you have it in your bylaws, or in the case of a school board, it would be policies. But at this point, I talked to Joe, and it was only a motion you made at one meeting. So I would encourage you to look at this and put it into policy. And I would really put serious consideration in having a different limit for discussion items, where there might be a lot of questions. Thank you.
Thank you, Margaret.
And Joe, you've seen the copy of the document. So if something has changed since I was on the board, let me know.
Thank you, Margaret.
At this time, I'd like to call Paul Horvath forward. Again, state your name and address. Thank you.
Good evening. Can everybody hear me okay? Perfect. So good evening. I am Dr. Paul Parvath. My address is N6885 579th Street here in Menomonie. I am coming today to fulfill my duties as the district's medical advisor. First of all, I want to make sure that I was here face to face and able to introduce myself and meet all of you. My clinical training is in emergency medicine. I practice primarily here in Menomonie. My wife is a family doc also here in town. We've got 2 kids that are in the district, one at the middle school and one at Oakland. So it's nice to meet everybody face to face. Thank you for the invitation. Secondly, I wanted to offer my services and offer my advice to you in terms of the district masking policy that will come up for discussion later in the agenda. My recommendation is pretty straightforward, and that's follow the CDC guidelines. Those guidelines, as you probably know, recommend universal masking in schools and in healthcare organizations. The tools that we have to combat the pandemic, we all know very well, including distancing and hand washing and masking and vaccination. You know, unfortunately, vaccination has not reached the penetrance that I would have hoped it would by this point. As my colleague, Ms. Gallagher, noted in her letter to the board, 66%, almost 2/3 of the community in Dunn County is unvaccinated, and 100% of our younger kids in the schools are unvaccinated, which really forces us then to rely on the other tools available, including masking. I know other areas have gone to a voluntary masking. I know that's the discussion for today. In talking with my colleagues in other districts and other educators around the state, their experience has been that sets up 2 groups, those who mask and those who don't mask, which inevitably causes some tension and some discord between those 2 groups, which really sets up an environment ripe for mask shaming and bullying. We all know the risks of bullying in our schools, and I would assume that none of us would be in favor of encouraging that kind of environment. So those are my recommendations. I'm happy to stay for the part of the meeting that I can. I'm happy to answer questions if that would be helpful to you. Forgive me, I'm not a Robert's Rule expert, but I can yield the rest of my time for questions, or we can address those later on in the meeting at your pleasure.
I think if you don't mind, if you could stick around when we get to the discussion portion on the agenda, or the action item for the masking, and then be available then, if you could.
Happy to do so.
Okay.
Thank you.
Thank you. Okay, that's all the communications that I have in person. Did anybody else have one yet that wish to speak? Okay. I will note too that there were a lot of emails that were sent to the district. I think we're over 40 now. That Joe has included the names of who had submitted stuff. So those names are in board docs on that. Okay, we'll move on to the personnel consent agenda. The action item is to approve personnel actions. Is there a motion to approve? Chris, is there a second? Clint. Okay, we have a motion and a second. Any discussion? Anything to note, Joe?
No.
Okay. Seeing no discussion, Jamie? Okay, motion passes 9-0. Moving on to the action agenda, item 3A, approve policy 171.2, agenda preparation and dissemination. Is there a motion to approve?
I'll move to approve.
Charlie, is there a second?
I'll second.
Angie? Discussion.
Dave, I'd just like to point out that the board did review this policy 2 weeks ago. Also, I appreciate Jamie's help in creating an exhibit, which would be a template that board members can refer to as they request agenda items.
Clint?
Where is this going to be located? Is it going to be something that's in the policies document so it's easy to find for board members? Because I know a couple new board members were asking me where this template was, and I thought we were really going to come up with something. So as long as it's accessible and consistent for people to find.
Yes, it'll be listed with the other policies and exhibits after tonight's approval.
Anybody have any questions on this? One thing that we did change on this is that agenda items are due by noon, 5 days before the meeting, so makes it a little bit easier for Joe and I to finish the agenda and have things ready for board docs that way. Any other discussion? Okay, Jamie, let's vote. Motion passes 9-0. We'll move on to action item 3B. Before I get to that, I just want to say, if the board would rather suspend the rules for the mask motion because of the amount of debate, that is something any board member can do. Requires a second and a 2/3 vote. Okay, action item 3B, approve the optional use of face masks in the SDMA effective June 4th, 2021. Is there a motion to approve?
I'll make a motion.
Angie, is there a second? Tanya? Okay, Angie, since this was your agenda item, I'll let you start.
I guess after reading,
Is your mic on?
now it is. After reviewing all of the correspondence sent in by constituents, it is very much an issue that is polarizing. There are equally as many people who are for it as don't support it. And I guess I can only really speak from my personal experience, having worked wearing a mask in a freezer and a cooler in guest service and heat. It's very unsanitary in my opinion. My child this year, she's 16 now, but when she started the school year, she was 15 and had never had a headache a day in her life until last fall. And I wholeheartedly believe it's from her mask and her physical exertion during volleyball. It's just something that we supported. We felt, not knowing COVID, what to expect. We were happy to be back 5 days in school in person. And I felt it was appropriate for the classroom setting at that time. But fast forwarding to now what we know now, I feel that it's time for parents to have the choice, like a parent like me who feels that it's doing her more harm than it is benefiting her. We work on being clean, we work on our immune system, we wash our hands, we do all of those safe things, and I put this forward because I support parent choice. And I know there's a lot of people that don't, but that's why I put this motion on the table, and I'm hoping that it will get support going forward. And I understand that there are people that don't support that, and I support their choice to have their children wear masks also. I mean, it should be an optional, and it should be parent choice.
Okay, thank you, Angie. Dr. Zadowski, did you want to have a word from KT?
Yeah, I think that would be appropriate, and I want to thank KT Gallagher for being here. And KT, if you want to step up, and then if there's any questions for Dr. Horvath, we could ask him as well. But before KT speaks, I just want to publicly thank KT for all the work she's done with our school district. It's been terrific working with her. Not terrific conditions, but she's been very responsive, oftentimes in the evening or during the weekends, and she's been terrific leading our county through this. So thank you for taking the time to be here tonight. And I guess with that, Katie, if there's anything you'd like to share with the board.
Thank you for the opportunity. This is not an easy year by normal standards. The work that you guys do to represent the community and the community's wishes is important. And it is divisive, and I want to acknowledge that to start. So, as Dr. Horvath had shared, supporting the CDC guidance as it moves forward and changes based on the evidence is important. We know that masks work. They work as source protection. So if somebody is pre-symptomatic or asymptomatic, it does a good job. There's a body of evidence that shows that it works as source protection. Secondarily, it works as protecting the wearer, but that's not its primary mode. And so by making masks optional, it does less to protect the folks that are concerned than it would otherwise to make it as a school policy, and that's concerning. As I shared in the letter that I submitted last week, our vaccination uptick is lower than I would have expected. We have about 10% of our population, 11% of our population that we know has had a COVID infection. It's probably an underrepresentation, but we don't know how long natural immunity will confer, or infection will confer some natural immunity. So while we have enjoyed a reduction in cases, there is some real concern that conditions will change, and that we will have a situation where we're not doing the prevention techniques that we need, and that we will set up a situation where we have unfettered spread in our school community that will bleed out into our larger community. So really consider the work that you do to keep your students safe and the community safe. I appreciate the open and ongoing conversation. I appreciate that we will work together regardless of whatever decision you guys make as a board. And I appreciate that there's a lot that is changing in real time as we move through this pandemic. Thank you.
I have one question, KT. So one of the CDC recommendations is that if you can get up to 6 feet of distancing or 6 feet of distancing, then optional face mask is possible. What would you say on that?
So we know that identification of a close contact is within 6 feet for more than 15 minutes. There are some organizations like the NFL that recognize that even closer with high rates of community spread, you still have that opportunity for transmission. So I think that with or without a mask, further than 6 feet away, they wouldn't be identified as a close contact necessarily, but that doesn't mean that if we're in confined spaces with poor ventilation, that we couldn't actually have a situation where we would have some spread.
Any other questions for KT? Chris?
So I would suppose you have two agenda items that are one after the other, but I would assume your recommendations that are applying for the first also apply for the second. And it's important that we keep those in mind. One thing I was thinking about was that especially this particular group that has had a fairly low spread of transmission before, the K through 5ers, one of our constituents shared an article that was put out by some Wisconsin pediatricians that said they were very concerned about an uptick in the spread among that particular group that we're talking about, which puts them at a more vulnerable place than they were, say, in September. So would you like to elaborate on that a little bit? Because one of the things that we have to try to figure out is like the difference between our feelings and our facts in regards to like what our good choices are for our students. And so this particular group, as a low-risk group, may actually be changing the more we know about their situation. And that goes to Dr. Horvath, too, if you had any insight into that age group of learners.
So I appreciate that. And I apologize, your title is board member?
Yeah,
Board
or
member
just
Remus.
Chris. That's good.
But without having seen the article, it's really very difficult to comment on that. I do know that we are seeing more adolescents as a state, and as a state, that's driving some of our increase. The littles, the folks that are 8 and younger, we do see cases in children that age, and we do see spread from kids that age because they really don't adhere to any personal boundaries whatsoever. And so that is the challenge. I would open it up, that same question to our esteemed medical advisor and see if there's anything more that you could share about that.
Dr. Horvath?
Can you hear me okay, or would you like me to come up to the microphone?
Okay, Steve?
I can hear.
Okay, I can talk pretty loud if I need to. So I couldn't agree more with Ms. Gallagher. Thank you for kind of walking through that evidence background. I appreciate that. Two thoughts. Number one, Mr. Freeman, Board Member Freeman, I couldn't agree more that historically the young kids have typically been the lowest risk group. They're not a zero risk group. We certainly see children, I personally have seen children that get COVID. Some of them get critically ill. Some of them go on to have long hauler syndrome. Some of them go on to have MIS-C, which is a systemic inflammatory response. All of those things affect their success in school. The other thing that I personally have witnessed, I am incredibly lucky, and I'm sharing a personal anecdote now, so take that as you will. I feel incredibly lucky that despite my high-risk work and my family's high-risk work, none of us have had COVID. That being said, all of my partners that have been sick have been exposed by their kids, which then goes on to affect the healthcare system at large, and again, any number of other industries in the community. So those are my thoughts.
Carl?
Yeah, so I hope to save time, I sent a fairly lengthy missive yesterday, and I apologize it wasn't Saturday, but I couldn't get it done on Saturday. So I will not rehash all that for the board. They've had a chance to look at that. One of the concerns that is commonly brought up is the belief by some that there's proven harm, carbon dioxide or other issues from wearing a cotton mask. And realizing we're not talking about N95s without a valve, we're not talking about industrial respirators. So can you verify a little bit what the evidence is on any risk of harm from masks versus the known low risk of harm to children from COVID, being that we should eliminate the risk we can and not trade a no risk for a risk?
Sure. So I think Board Member Palmer, you kind of just laid that out for me. Really looking at the letter they sent also has the scientific brief from CDC on the evidence base of masks, and they also speak to the lack of evidence of harm associated with these types of either cloth-based coverings or procedural masks. So that's where the evidence base lies. The risk to children, as we've already discussed, is low, but the risk of COVID can still adversely impact them for the rest of their lives. It can adversely impact their family. The transmission from them to family members has resulted in deaths in our community.
That helps, thank you.
Clint?
Thanks for coming, KT. You mentioned the effectiveness of masks in our schools and public institutions. Could you reference a study which shows the effectiveness of masks? Because obviously in a study like that, they'd have to have had a control group where there was a school where the masks weren't required. And we've already got local schools in our area who have gone to mask optional. And I'm curious to kind of watch and see how those go. Just because I haven't seen one that actually has a pure control group, because obviously there's risk in a study like that as well. But I'm just curious, something that would show the effectiveness, because another thing, big elephant in the room that we're not addressing is all the other ramifications, all the social, emotional learning issues with wearing the mask. And it's constantly been a balancing act preventing the transmission of COVID. And, I mean, we saw some emails that came to board members from staff members and teachers, some of them that teach our younger students, kindergarten, and what it's done to their learning. I mean, I sit down with my first grader last weekend and read through an end of the year little book that they put together, and all but one of them mentioned how horrible their year was because of the masking. And it's sad, it's depressing. Our kids are not wanting to go to school anymore. I know of some families that are not putting their kids in our public school because of the mask. So my last part of my question would be, at what point are we statistically going to be low enough that we can say that masking should be optional, it's appropriate? The CDC seems to keep changing their mind on recommendations from day to day, week to week. And I understand, we had a very heated debate about social distancing when we talked about the reopening plan. And then that all evolved, and now the rules are changing once again. So I hope you're taking notes, because I kind of threw a whole mouthful at you. But any response you can give, I'd much appreciate.
So I appreciate that, Board Member Moses. Really, again, you laid it out very well. There isn't a case control study because we're not going to harm people by having a control group. It just doesn't exist. So to look at the evidence, it's got to be an observational study, and we are building that evidence. We'll know more. So the CDC has changed its guidance, and I know that it's challenging, but they are following the data. So I do believe we will get to a community prevalence where we don't have the same type of risk of transmission. And honestly, everybody who wants to be vaccinated can be vaccinated. And at that time, I believe there will be a change in what the CDC puts forward, and it will include strictly masking optional.
Can I, follow-up question? I'm curious, as a county, I know that you're able to order so many doses a week. Have you had to cut back on that drastically in the last month because of vaccine hesitancy and people just not wanting to get the experimental treatment?
Sure. So the vaccine has gone through trials, and it has been proven safe at every step. The quickness that it came through isn't indicative of any change or cutting corners in safety. So I need to put that out there first and foremost. A matter of time. I do believe that the Pfizer and Moderna, they've already expressed publicly that they will look for a BLA or FDA formal approval. Typically that takes about 6 months. We're coming up on that. I fully expect that they will ask for it and they will get it. So this isn't experimental under emergency authorization use. It is moving through the process to keep people safe and healthy.
Yep. My question was, have you had to cut back on the number of doses? And the FDA still does list it as experimental.
Sure. So thank you for the clarification. Again, there was a lot in that question. So as a state, we have all had to reduce the numbers that we have requested, because as we hit the kind of people that are early adopters, that moves quickly. And really what we're left for is that movable middle, the folks that want to have a conversation with their personal health care provider, and folks that aren't able to receive the vaccine. So we have had a reduction in what we're ordering.
Thank you.
Thank you. Amy?
My question is, I've heard of the variants that are coming out. The vaccine does protect people from that, but I understand kids are more prone to get that variant if they're not vaccinated. And I don't know if that's true, but I have heard that. I wonder if you could address that.
So I feel like I want to restate that back to you to make sure I understand. Are the children more common to get, is it more common for children to get the new variants versus the older variants? So I would say that largely has to do with what's circulating in the community. We are seeing an increase in the B117 variant, so that's about 75% of the COVID that's being genotyped right now here in Wisconsin. So if it's a reflection of what's prevalent in the community, yes. Are they somehow more susceptible as children than adults to different variants? I can't speak to that.
Thank you.
Dr. Horvath, if you have anything that you want to say, please jump in.
Thank you. I actually appreciate again Katie's comments, and I just want to build on what she mentioned. My response to that is right now the kids are the biggest unvaccinated group. So my impression of that data that you mentioned is that there's higher spread in the unvaccinated population because we know these variants are more contagious and more susceptible to getting people sick. So I would agree. I've not seen any specific data that tells us that kids are in particular at higher risk, but kids represent an unvaccinated cohort.
Thank you.
I guess my question would be to either one or both of you. How do you balance that with when you go outside and you go to stores and there's hardly anybody, most of the businesses have gotten rid of the mask mandates. Kids in general, when they're together, you don't see masks. I was at a couple grad parties this weekend and nothing at all, I mean, how do you balance what kids are doing outside of school and with their families and everything else with what you're asking the schools to do?
It's an incredible challenge, absolutely, President Steyer. I think two wrongs don't make a right. I also think the way you're within your span of control, within the buildings, we have a different level of risk than what happens outside of your building. When we do contact tracing, we see a lot of transmission in parties, in sleepovers, in get-togethers. We really do. But we didn't see that in the schools this year in the same way because of the multi-layered non-pharmaceutical interventions that you as a district put in place. So it is a challenge. It is absolutely a challenge that when you go over to your grandma's house, you can act a different way than when you come to school. But you do that anyway. In what kids are required to wear, how they're required to comport themselves. There are a lot of differences between the way we act at home, at the grocery store, at the bar, and at school.
I guess just as a follow-up to that, I spoke to a number of teachers who reported in the last 2 to 3 weeks, especially since the CDC guidance came out, that they're seeing a lot more difficulty with compliance in the classroom. And I guess my fear is that's only going to continue as we go forward. How would you address that?
I think it's an incredible challenge, absolutely. Again, the optional issue makes it more the haves and have-nots. If it is the way that they're expected to behave when they're here, it's going to be a lot easier for those teachers to toe that line and to gain compliance.
Chris?
And I just was going to try to get some clarity on some of the questions that Clint was asking, just to make sure that I'm understanding your answers correctly.
Sure.
So the first one was that the studies that have been shown you believe to be absolutely valid in terms of their conclusions about the effectiveness of masking in our schools. So absolutely valid. Control is not necessary. And then the second thing was, and this was the question that he was asking that was not answered, like, what is the target for vaccinations or for people who have had COVID that we're looking for? So the question is that lots of people think this is going to go on forever. But you guys have a strict determination in terms of what that looks like. And so can you tell us what that looks like?
Sure. So again, this is science in real time. We'll know when we hit that threshold, when we hit it. But looking at other highly contagious droplet-borne illnesses, we're looking at about 75% of people, which we call herd or community immunity, to either have vaccine-acquired immunity or naturally acquired immunity. We're not there.
And then the last follow-up question is for clarity. When Dr. Moses labeled this as an experimental vaccine, that can be kind of dangerous because it makes it appear that it is uncertain in terms of the effectiveness or also the safety, especially for a community like ours where it's hard to get those kids and those families into the vaccines. It's experimental, but that doesn't mean it's not safe, and that doesn't mean it's not effective in your estimation. Is that true?
Correct, I believe it's safe, and I believe it's effective.
I just want to make a comment on the evidentiary basis for all of this. We in medicine try to work in best available evidence, recognizing that perfect evidence generally doesn't exist. The evidence that Ms. Gallagher laid out is the best evidence we have, and we continue to gather more as time goes on and as your experience grows.
Any board members that have none? Charlie?
Given where we're at with the percentage of people that have been vaccinated and the slope of that line, if you will, when do you expect we would hit that threshold? It seems like that's a long ways off.
Sure, so I think hitting the threshold of 75% is, that is a crystal ball kind of question. And if I could make those kind of estimations, I would make a lot more money doing something else.
Well said.
But I think that we will get to a point probably sooner than that everybody who wants to be vaccinated can be vaccinated.
Just as a follow-up to that point, Katie, so what are you seeing what is the percentage of increase in vaccination rates in the last 2 to 3 weeks? Say 3 weeks ago versus this last week?
Sure. So last week we had about 700 new people, 700 doses delivered in Dunn County residents. Before that, we had been much higher at, I think our highest one week total was a little over 2,000 doses, 2,100. So it is a reduction. We are continuing to work within the community to meet the community where it's at. So there are barriers to vaccination for some folks, like transportation, like phobias of being in a clinic setting. And so we need to work harder to undo some of the barriers that different socioeconomic situations set up forward, different educational attainment sets forward, and really meet the community where it's at. So there is still people in that movable middle, but there has been a reduction, like I said earlier, in the number of doses that we delivered last week over the week before.
Has the health department done any surveys as far as the county is concerned as to what the expectation is or will be for vaccination levels?
Let me reflect that back. So are you asking, have we done any surveys on what the community thinks is good enough?
Just from getting feedback from the members that live in Dunn County, how many of them plan on getting vaccinated? I mean, do you have any idea if it's 50% or 70% or?
So we have not conducted a Dunn County study on people's intention for vaccination.
Thank you.
So during my COVID reports that I share with you every time we have a meeting, when we met 2 weeks ago, 31% of the population in Dunn County had completed the vaccination series. And based on the Facebook update today from the health department, it's gone up to 33.4. So 2.4% over 2 weeks.
Carl?
May I make another short comment?
Yeah, in my viewpoint, we've had a ton of questions and not so much commentary from board members. So if you're making commentary, I ask that you police yourself on that.
Yeah, this will be short. 2 things I found interesting. I think some of you know that I'm a nurse for 23 years. Worked in a lot of settings, and I do consulting with rural hospitals. Rural communities around the country are struggling to get their folks vaccinated outside of the hospital staff. The hospital staff are doing pretty good, but the rural communities are struggling. There's concern that those gaps in vaccination rates are going to cause, stewing little spots of COVID that don't need to be there, that will cause further spread later down the road, that could disrupt, school years later. But interestingly, I talked to a hospital yesterday, a very small hospital in Montana, and they, as a hospital, decided they were going to buy 2 airplane tickets to Hawaii and raffle those off to patients who got the shot in the next 3 weeks in their community. We've seen motivation in states like Ohio, where there's get a chance at a lottery ticket for $1 million, which had a double-digit impact on people's willingness to get vaccinated. So my one observation is that it is very interesting to me as a nurse how little it takes for some people to decide to get this shot as opposed to other motivators. A chance to win a ticket to Hawaii and then now put that thing in my arm, I'm fine with it. So that's an observation, that's all that is. And the second one that I struggle with on this topic is acknowledging that absolutely half of the people in our community strongly feel one way about things right now, 50% feel the other way. And as a nurse, I respect that. I respect your right to choose what you put in your body, what pills you're gonna take. But my job as a nurse, KT's job as a nurse, Paul's job as a physician, is to provide information and let you try and decide what's best. Where I'm struggling is that a request to allow me to choose to not wear my mask may put someone else at risk, and they don't have that choice as an 11-year-old kid to be vaccinated in that situation. So that is my struggle with this situation from an ethical standpoint. I do support people's rights to choose their own health care.
Any questions? Mark?
I guess I don't have a question, but I appreciate what you just said, Carl. I actually reached out to a lot of people and had a lot of constituents contact me over this mask issue. And I talked to city workers, business owners, healthcare professionals, law enforcement, parents, a ton of people, and I'm talking more than 100. And it was overwhelming. Overwhelming. Like, I'm talking like 100 to 2, where people want the option. People want the option for their families, for their kids, to either wear a mask or not wear a mask. Now, I understand what you're saying about the other ones don't have the option, right? But I mean, I think I did my due diligence on this, and my job as a board member is to listen to the people and do what the people want. That's my feeling on it. Some healthcare professionals may disagree with that, but I'm not a healthcare professional. So I gathered my information, and I just want you all to know that that's what I found.
Thank you, Mark.
Well, I guess I got a question to follow up on that. What would you say to those 98 plus people that want the option?
Sure, so again, I would go back to making that option that could create illness for another family. So your right to swing your arm stops at my nose.
I have a question.
Angie?
So, people that are vaccinated have come down with COVID, and they are passing it on. There have been, that has been in the news, and now the CDC is saying that if you have been vaccinated, you don't have to wear a mask. So you're telling me that these people that have been vaccinated now are carrying COVID and passing it around and not wearing a mask. How is that any different than what we're asking today for personal choice?
Thank you for the question, Board Member Skillings. The difference is an order of magnitude. So when in Dunn County we have 4 breakthrough cases out of 15,000 people, that is not much. When we talk about reinfections, we have 38 cases out of about 5,000 cases. That's not much. Transmission is much, much lower. And then when we look at our number of cases in the same time frame, that's much higher. And the amount of transmission or secondary or tertiary cases is much higher. I don't have any secondary cases from breakthrough. I don't.
So the cases that I was referring to were the New York Yankee cases, and they were all asymptomatic, and they would not even have known that they had COVID, were they not tested. So how do you know that that is not going on in your community?
So thank you for the clarification. So with the baseball team, they were vaccinated with the Johnson or J&J vaccine. It has a lower level of efficacy and effectiveness in real world. One of the cases was slightly symptomatic, and there is a huge difference between completely asymptomatic and mildly symptomatic. The transmission was from the mildly symptomatic person.
So how do you know there are none in your community that are?
Okay, Dr. Horvath, did you have anything to add?
I actually have a couple of comments, if I may. Number one, nothing is perfect. I think we all recognize that. Including masking. Number two, oh shoot, I lost it in the in the transition here. Let me actually address the first question, if I may. We as experts, we as leaders, make recommendations. What people to choose to do with those recommendations may be certainly up to them. In my day-to-day work as an ER doc, I have to work at 11 o'clock tonight. I will frequently make recommendations that patients may or may not want to do. My job as an expert is to make that recommendation.
Okay, Tanya, have you heard anything?
I'm good. I'm good.
Anybody, Dr. Zadowski?
I just had a couple things. Fortunately, we have not had a student case in our district that's been reported since May 5th. And we haven't had a staff case since February 7th. Are we seeing similar numbers in the other district in our county that is not using masks? Or are they seeing a higher prevalence, would you say?
So we're seeing an overall reduction in community rates. We absolutely are. It's a little early to say for certain that we've had a disproportionate, or that they are the equivalent, mostly because when we look at 14 days as an incubation period, we're still just barely outside of that.
Sorry, I came back to my other point, I apologize.
Okay.
The CDC guidance, as was mentioned, leaves out, Katie, help me out here, leaves out 3 particularly high-risk scenarios. Number 1 is public transit, where people we know are crowded together and unable to maintain social distancing. Number 2 is healthcare organizations. And number 3 is schools. And forgive me, there's a 4th.
The 4th is in homeless shelters, jails, and other congregate living situations.
So the point there is, yes, the CDC guidance is evolving as we learn more, but the CDC has specifically called out high-risk scenarios where they would continue to recommend masking and recognize that other lower-risk settings are maybe appropriate to not mask, particularly for those who are vaccinated in outdoor settings where they're able to maintain appropriate distancing.
And I want to be very clear, I'm not saying this to advocate one way or another, but one thing and I've read all the CDC information, it's hard to retain it all, but when they say for schools, I have a bit of a hard time with some of it applying that to Menomonie. If you're talking about some schools in some areas, especially some urban areas, where it's full enrollment and classrooms are packed, I think that's a lot different than what we're looking at here, where through the great work of our staff, we've been able to get 6 feet across our district. In summer school, we still are planning on cohorting and having 6 feet of distancing. So while I fully agree that that's what the CDC guidance says, I don't know if it's a one-size-fit-all recommendation. I do think there is some local caveat to that could be considered.
I guess that goes back to my earlier question. One of the bullet points from the CDC says that mask use in their mind is optional if you can get 6 feet of distancing. And I know we spoke about that already, but a lot, our schools, the way we have things set up in that, they are. I guess my question for you, Joe, is with the summer school, do you anticipate that we'll have that distancing with the classes that we have?
Yes, and I will say though that when we say we have 6 feet across the district, we know that it's not perfect. And I don't want to reflect that there's never a time that students aren't within 6 feet. And certainly when they, eat lunch together, that's an area of concern all the time. So there are, but to KT's terminology, we do have many layered mitigation strategies that have been effective in our district, but it's not perfect. But for summer school specifically, yes, we are planning on distancing, we are planning on cohorting, and then the board's going to decide tonight whether or not masks will be part of that as well.
Does anybody have any other questions for KT or Dr. Horvath before? Clint?
I got one more. And Dr. Horvath actually kind of reminded me of this thought I had. Many I'm a healthcare provider. I care deeply about the health of this community, and I echo Dr. Horvath's frustration when we give recommendations and people don't take them. The problem I have with this is we're setting a policy that takes away that choice. And I understand we're looking at protecting the community as a whole. So that's really the challenge with this, is it doesn't just protect me, it protects the whole community and the overall spread. But I just can't go for something that continues to take away that personal choice to someone. I mean, I may be frustrated when I give someone health advice and I see them out doing something unhealthy, but I gotta look out what's best for my family, my kids, my 4 daughters that are in this district, and this can't continue. So the vote for me is gonna be yes. I encourage those of you to think about each and every one of you in your situations and what you think is important or what you think, weigh up the cost and the benefit. And in this case for me, I have to. And I echo what Mark Hillman said as well. I've had probably, not maybe 98 to 2, but probably 80, 85% that just want to be done with this thing. So.
I think we all want to be done with it. I think we can absolutely agree on that. I don't know if anyone else in this circle of tables has attended a funeral of someone who died of COVID-19 who was their friend, but I did at the Veterans Cemetery. And so, yes, the person was older, they weren't a 12-year-old kid, but it leaves a mark to do that. Real life is messy. We know that, right? Whatever we pass tonight or don't pass, and the rule, what this board passed that kept us in school prior to us being on this board, worked pretty well. Thankfully, our kids stayed in school. Really didn't have a huge problem out of it. But in real life, we know that there was times, proms, sports events, whatever, where kids weren't wearing a mask the way we asked them to. And that puts faculty and teachers in a tough spot trying to enforce. But I would argue that still trying to do the best you can with the rules that science supports is better than nothing at all. And I still have a concern about other people's freedom to choose affecting other people without the ability to make their own choice in the situation. Lastly, it frustrates me a little bit that we are talking about an on and off, all or nothing approach to coming off of mask use. And I get it because life's messy. When my kids go to Luther Park Bible Camp, they have to jump in the pool and show that they can swim. If they can swim, they get one colored wristband, and if they can't swim, they get another colored wristband. And it means that kid can't, if anyone sees a kid with the wrong colored wristband swimming, they don't get him out of the pool, something bad's gonna happen. I'm not proposing we do that, but strategies that are based on showing vaccine status even increased the attendance at the local racetrack, from what I saw, which is a fantastic carrot for people to be vaccinated, not a stick. So it is frustrating too that we don't consider, is there subsections that evidence would better support, saying let's back off on masks in some situations. So if the kids are outside at summer school, no masks, or these would be alternatives. They may not be in line with the CDC, but we're not even thinking creatively about any of that. And so I guess that's where I'll leave it. I'm a nurse, and I guess you can probably figure out I'm going to vote with what healthcare is saying right now.
Thank you, Carl. I think Amy was first.
First of all, I'd like to agree with Carl. A couple of things. I would I'm going to go with the recommendations of health and science because I think it's really important. Our school district had some cases this year, but something that somebody posted, and it may have been Alex Hall, where she compared school districts, and you can see the lines. This is very interesting. But the school districts that were hybrid, and we weren't hybrid, we were, go all day, which is fine. But the people that were hybrid and masked are much lower in their cases for staff and for, significantly in my mind, or when I look at the thing. So what I'm trying to say to you is I don't think we're ready. I have a feeling that the CDC is going to come out soon. I think if we just hold on a little longer, I think we're going to come to a time when the CDC is going to say, okay, let's do masks as optional. I think we have some things to, like higher vaccination rates. But when I think about kids who are, under 12 that cannot be vaccinated, that's very scary to me. Like Carl, one of my very best friends, her in-laws both died 3 days apart. Yes, they were elderly, but they both died of COVID within 3 days apart. I have many other families and friends who've had issues with COVID. And it's not a pretty case. We also have at least one long hauler in our district that I know about, a student. So, and that person was an athlete, and as far as I know, that person could be ruined for life. And that was when masking was taken care of. So, so those are just my things. Thank you.
Thank you, Amy. Charlie?
I spoke with one of Dr. Horvath's former colleagues today, and he reinforced for me what I've been thinking for a long time. I agree with Amy, believe it or not. I don't think we're ready. I don't think we're ready for this, to do this. I think the votes are here to do it. So I guess I'd like to propose an amendment that will probably make everyone unhappy on both sides. But what I would like to propose is that we allow the kids during summer school to remove their masks when they are in the building but more than 6 feet apart. And remove their masks when they're out on the playground. In other words, socially distancing. If they're closer than 6 feet apart when they're transitioning or sitting closer, they have to wear the mask. Like I said, I'm not expecting that to make anyone happy on either side, but I think it's a compromise that we could probably live with until maybe the CDC comes out with something that would change where we're at. So I would like to make that formal amendment to the motion on the table.
We have an amendment. Is there a second? Is there a second?
I've got a follow-up question for Charlie.
Is the first that's finished?
It's getting clarity what he's proposing. I think I'm allowed to ask a question, point a question, and an amendment. So Charlie, would you be willing to ask our healthcare professionals if they feel that would be a prudent recommendation that they could get behind, why or why not?
I have no problem asking the
Before you
question.
ask.
I'm not going to change my amendment, but I have no
that's
problem
fine.
asking the question.
I think that there's something protective about being outside. And if they can maintain distance outside, I think that's okay.
Dr. Horvath?
I think our tools are layered, as we've talked about a number of times this evening. The more of those tools we can safely apply, the more protection we add to our population. I couldn't agree more with Ms. Gallagher. I think masking outside is a low-risk, in general, low-risk situation. I do have some concerns with unmasking inside, even with social distancing, primarily due to airflow limitations.
Keep in mind that the district did do a fair amount of increasing of the airflow last fall, but I understand the point.
We have an amendment on the floor. I'll ask again, is there a second? Is there a second? Okay, the amendment dies. Discussion on the main motion. There's still, I think, a couple of you that have time left if you wish. Chris?
Yeah, I'm just having been on the board through this whole process. I'm a little concerned that board members that have been here since the beginning when we started discussing masking are changing their criterion for judgment. And that now choice is I'm hearing as being more important than science. And that certainly is not the opinion of certain board members throughout this process. And I would remind all of the board members that Joe, who's been doing an excellent job explaining to us and proving that he's adaptable, that when the science shows that it's ready to go, that we'll make adjustments. When Joe asked us for questions on the May 10th meeting, no questions. At the previous meeting, I believe it was April 26th, our collective statement on the board was that we would follow CDC guidelines. We wanted to follow the science. Now, nobody raised any concerns that I've heard board members raising tonight in those previous board meetings. And certain board members that have expressed different opinions on the criterion of judgment for when we're going to back science and when we're going to back public opinion have also changed their criterion. So I'm deeply worried that the people that we are serving don't see any consistency to what we do. That's highly problematic. And for certain board members to not have raised these issues before now, in a highly politicized atmosphere, where there's a degree of grandstanding, I'm a sign of surprise. Now, I would like to make my own motion. I would like Charlie's motion. I would like to make a motion that during the summer school, that those kids, when they're outside, and they can be distanced, can be without their masks. When they're inside, they wear their masks. And that's my amendment.
We have an amendment to the motion. Is there a second?
I'll second.
that.
Carl? Any discussion on the amendment? Clean slate, if anybody wants to talk about the amendment. No discussion. Okay, we'll vote on the amendment, which, where motion is to approve the optional use of face masks in the SDMA effective June 4th, with an amendment stating that while the kids are on the playground, they don't have to wear the mask outside, correct? So all we're voting on right now is the amendment to that motion to change, to add in the language that while they're outside of the playground, they don't have to wear their masks. Is that worded the way you want, Chris?
Any outside activities, it doesn't have to be on the playground. And I had intended, as Charlie did, to make this relevant to the summer school session. But I think our school is effectively done. So maybe that's a meaningless difference. When is our last school date?
We still have 7 more days.
So my amendment would have been just as Charlie suggested for summer school session. And that we would continue to mask, as we have been saying we're going to be doing all year in every meeting that we've ever had, that was going to be our policy. So my amendment, to be clear, is just referring to our policy in summer school. And that means that we would continue the policy we've had all year, and that we make an amendment to change how we mask in our summer session, and that applies to any outdoor activity as being a maskless environment.
Yeah, help me out here, Joe. Is that a new motion?
I think everyone understands it. Does anybody have any questions?
Amy?
Just to clarify, if we vote yes, we're voting for the amendment.
We're on the amendment right now. I guess where I struggle is the main motion is to approve the optional use of face masks. Now we're adding an amendment to that saying that are you asking to change the language from optional to only allowing use for outside activities, or not to use it for outside activities?
Do you want me to answer that?
I'm asking your
Yeah,
intent of your
it's
amendment.
doing two things. One is changing the date and the context to summer session. And the second thing it's doing is to make masks optional for outside activities during the summer session.
So then all the other optional stuff would go away. That's your amendment, right? In classes?
That's exactly.
Okay. So the vote then is on the amendment to the main motion to amend it to read only for outside activities. And I believe the date hasn't changed because we're starting June 4th, which is the first day of summer school or a possibility for summer school. School ends June 3rd. Correct? Anybody have questions on that?
So just to be clear, because it's not clear.
I know. I'm sorry.
Right, so his amendment, Chris's amendment, about the outdoor, off-mask, proposed amendment, if that passes, then we would either be voting for that or the mask optional, or is this the final?
This would, if that passes, this becomes the final.
Thank
And
you.
it takes away the optional in-class portion of it. So thank you.
Understood.
But there still would be another vote on the main, that would then.
Yes, there will be a second vote. The first vote is just for the amendment dealing with the outside activities. If this passes, then our main motion becomes to allow exactly what Chris proposed, make mask use optional for outside activities. If it fails, then we go back to the original motion, which allows face mask use to become optional starting June 4th in the district. Okay? Any other discussion? Okay, Jamie, let's go. We're voting on the amendment. The vote yes would be to support Chris's amendment.
Start with Chris Freeman,
Yes?
Mark Hillman,
No.
Donnie Giuseppe. No. Clint Moses,
No.
Carl Palmer,
Yes.
Amy Riddle Swanson,
Yes.
Charlie Schneider,
No.
Angie Stillings,
No.
Dave Starr,
No. Motion fails, the amendment to the motion fails on a 6-3 vote. Now we're back to the original motion, which is approval of the optional use of face masks in the SDMA effective June 4th, 2021. Any further discussion on the main motion? Before we vote, I want to thank KT, Dr. Horvath for coming tonight and providing your insight on this. We really appreciate that.
Can I make one short statement too? I also feel, this is a hot topic, and I thank the board for keeping cool throughout the whole conversation as well.
Thank you. Okay, Jamie, let's
Well,
vote. Oh, I'm sorry, Chris.
And this is just to help out Mark. It's really nice that you let him gather all the information. But there's, what you really want to think about is when you're gathering data like that, if there's a real inconsistency in the numbers you're getting, that means there's probably a problem. So from the big data that we've compiled, it's a 50-50 split. Okay? So when you compile your data, that shows it's a 98%. That illustrates
From all walks of life.
no, okay, that's true, but like, so for example, like, let's say Joe and I asked two people the same question, we would get different responses based on who we are. And so when you gather data that creates real, a real skew in terms of what you're getting, you might want to think that the data you collected may not be as valid as you think. Because when you put it against larger data sets, it kind of falls apart. So it's really important that when you think about how you collect information, and as a school board, we're trying to use facts and to try to use the type of decision-making that our community can have faith in. And if we're using anecdotal evidence, and if we're creating statements that appear to be politicized, I don't see how our community can have faith in the types of decisions that we make, especially if there's a lack of consistency in terms of how we voice our decisions. So I would just ask all of us to reconsider where we've been as a board on this question since last summer. And then what has happened to change certain board members' opinion about where you're at right now. Now that's based on your feelings rather than the facts. That's a problem.
Okay, any other discussion? Jamie? Is this gonna be on board docs, Jamie?
Just to clarify.
Okay. So the motion
You
that
don't support it, and yes would be you support it.
a vote yes means you support making face mask use optional in the district. A vote no would mean that you do not support.
Did you get yours, Mark?
No, I lost connection.
Do you want to do a voice vote, Mark?
I can if you want.
Pardon me?
I said I will.
Go ahead. You vote yes or no?
Yes.
Is that everybody? Motion passes by a 5-4 vote. Okay, next item on the agenda, item 3C, approve the optional use of face masks for the Menomonie High School graduation ceremony, May 30th. Again, Angie, this was your motion. Anything you'd like to say?
Not at this time, I really don't have anything to add to what the discussion we've already had. I mean, I know my daughter attended prom and it wasn't very well enforced or utilized, and there were really no repercussions from that. I know that my daughter also says currently in school, they're not utilizing the masks appropriately until the teachers show up or the principal walks down the hallway and then everybody puts it on, otherwise it's in their pocket, et cetera, et cetera. And so I just feel like as a senior, their last day is the 28th of May. They'll be coming back to the building for the graduation ceremony. It's parents and a child who live in the same household. There's going to be a level of social distancing already involved. If they would like to have it be optional, I would support that.
Any discussion? Clint?
Just for my own clarification and that of the community, Dr. Joel, if you wouldn't mind explaining what other mitigation measures will be in place for graduation and kind of the layout, how it's planned to go ahead, so we can make a good decision on this one.
Well, we're going to distance the best that we can. You know, typically graduation, you know, we pack that gym. There's not a space open. All the bleachers are full. We move the portable bleacher in the back. We have the stage, and then we have students, and then we still have family seating on the gym floor. With our plan to spread the students out as far as we can, it won't be 6 feet, but we're going to try to spread them out. Essentially, the whole floor is going to be taken up by students, and then guests will be limited to parents and guardians only, with the exception if there's only a parent or guardian for a particular student, then that parent or guardian will be allowed to bring a grandparent or yeah, so every student will have 2. There may be a situation where there could be multiple parents or guardians, but generally it'll be 2 per person.
Any other discussion? Amy?
Just the fact that you're not sure that you can get them 6 feet apart is a little concerning to me.
Yeah, they're not going to be 6 feet apart. Not
That, to me, that's why I think a mask would be important.
sure.
Anybody else?
Has there been any insight provided by our medical team on this specific issue separate, or do they wish to? I guess I have to ask you to ask that maybe, but.
No, anything either one of you would like to say about the graduation ceremony?
My recommendations are unchanged.
Okay, Katie? I'm sorry.
No, my recommendations are unchanged, and just one follow-up question. I heard that the students would be not 6 feet apart. I've not heard what that means for the audience. And that might be important to clarify as the discussion unfolds.
Sure, yeah, the audience, we are gonna try to cohort in the family groups. They're still figuring out how much space they'll be able to get. We're gonna try to get 6 feet or as close to 6 feet as we can in the stands. It's definitely gonna be more spacing than any graduation that we've ever had. But I don't wanna say that for sure there's going to be 6 feet.
Any other discussion? Amy?
I would think that it would be possible because they would not be with it, they would be distance maybe for a very short time to getting their picture taken. I can understand taking their mask off, have a picture taken, and then put it right back on. Because it would be less than 15 minutes, and I don't know if that would be something that would be okay with.
Well, we're planning, we did that last year. That's kind of a given, Amy.
Thank you. Any other discussion?
Do we know
Carl?
anything about air exchange in that gym specifically? It sounded like there was a lot of work done. Do we know how many air exchanges per hour or anything that, I know the last graduation I was at was hot.
In the new gym it was?
Yeah,
Okay.
but it was a couple of years ago.
Okay, well, I know that they have cranked it. And actually, with all the outside air we're bringing in, it's more difficult to control the temperature. Like last week at the middle school, Mr. Betcher said he could almost skate on the floors with all the humidity we were bringing in. But we are exchanging air as best we can.
But we don't know a count.
I don't have the exact number of exchanges, no. I don't.
Okay.
It has been ramped up a lot since last year.
Yes.
Any other discussion? Okay, Jamie, let's vote.
Can you please clarify who made the motion and second on this?
Did I do that?
No, I'll make the motion.
I'm sorry. Motion by Angie, is there a second? Clint? Sorry about that. So a motion, if you vote yes on this, you're supporting optional use of face masks for the graduation ceremony on May 30th. Are you up, Mark? Are you back online?
I'm back in action.
Yep.
I'm done.
Motion passes 5-4. Thank you. Action item 3D, approve additions to the 2021-2022 staffing plan. Dr. Zadowski.
So the directors have brought me these recommendations. First of all, increasing the high school math teaching position from 0.5 FTE to 1.0 FTE, and then a special education transition coordinator from 0.5 FTE to 0.6 FTE. That would be for the 2021-2022 school year.
And with the transition coordinator program, we did have a report from Jill not too long ago, exciting all the good things that are happening in that department. Any questions or discussion from the board? Okay, let's vote. Oh my gosh. Motion by Tanya, second by Angie. I apologize. Next time, throw something at me. Another Robert's Rules of Order book. Motion passes 9-0. Moving on to discussion item, policy review. 4A, COVID-19 report, and we do not need a motion for this. Dr. Joe.
We've talked a lot about COVID tonight. I'm happy to just provide it for you to read if you would like. There is one thing I really want to point out though, on the school nutrition part towards the end, Our team has developed that free meals for kids program again over the summer, so families can sign up and then they can come and pick up a week's worth of meals, breakfast and lunch. And we certainly encourage our families to take advantage of that. That's for all kids, not just students on free and reduced lunch. It's a great program. My family participated in it last year, and I would recommend it to all school district families. But we do ask that you fill out the online form to make sure that the food can be ordered and prepared. And what I really liked about it is that when it came lunchtime, the kids could just look at the menu. They got a chance to, it's not a lot of cooking, it's more, heating things up, but it is a good experience for them too to learn some responsibility depending on how old they are. Are there any questions about the report or anything you want me to cover?
Okay, thank you. Moving on to review preliminary budget for 2021, 2022.
Okay, Leah has done the lion's share of work on this. I get just a couple of introductory comments and then I'll turn it over to Leah, especially if there's questions. But this is one of those years where we're going into a state budget. We don't know exactly what our revenue is going to be, so Leah has created a couple different scenarios. You'll see right now we are projecting a deficit, but with the COVID money, the ESSER funding, there are things that we should and will be able to do next year. So there's a lot of unknowns, a ton of unknowns, but I think Leah has put together a good preliminary budget. Anything specific you want to share, Leah, before you take questions?
Sure. The 21-22 budget estimate document, that's probably the best one for you to take a look at. That lists all the key assumptions that went into building this budget, and then it lists all the revenue line items and expenditure line items that are different from this year to next year. So this document really kind of explains everything and has all the more fine details in it.
Any questions for Leah at all?
Questions from the board. So this is our blueprint, our base blueprint, the first glance at it for our next year. This will be used in our budget summary meeting. And
so this will come back in June for the board to approve, and then it'll be published for the annual meeting. There certainly will be changes as we learn more about what the state ends up doing with the state budget. But yes, this will be coming back to the next meeting for your approval.
okay, thanks, Leo.
Thank you.
Okay, moving on. Item 4C, discuss desired changes to key pillar strategies, strategic action deliverables, and measurable goals. Dr. Zadowski.
So I appreciate getting feedback from the board. And as you know, strategic planning really got put on the back burner. And I do have to tell you, I'm a bit nervous looking at the plan and refamiliarizing myself with it. We still are making great progress in the district, but when we put this plan together, we knew that it was an aggressive plan. We knew that it was a comprehensive plan. And even the consultant, when she presented to the board, talked about, we do need to be careful that we don't overdo it. I know that we're still going to be dealing with COVID next year in some form or fashion. So I am a bit nervous looking at it, but I think it's critical that we keep moving forward. And I do think there's many parts of the plan that are still very relevant. Projects that we do want to focus on, we do want to complete. Other than that though, you can see that Amy and Charlie both offered a couple suggestions. And I guess if you want to leave it up to them, Dave, to talk about them.
Okay, who wants to go first? Amy?
Sure, I'll go first. Actually, I had more changes, but Joe told me that some of the things were already being done, so I nixed them, but I did have some things on the social emotional learning too that kind of did this. But the changes I made was on the talented workforce. You'll notice on bullet point, let's see, 1, 2, 3, 4, 5, 6, it's in red, 7. I would like to add some stuff for PD, and that would be incident bias training, de-escalation techniques, and LGBTQ training and education for PD areas. And then over to the right where it talks about measurable goals, I think it would be great to conduct exit interviews, which I've told are already done, but maybe with a little more reporting to us would be helpful, and maybe some questions designed. It would be nice to know why teachers resign. A lot of them I know go to other jobs and so forth, but it would be nice to find out why in order to glean information that would be helpful in retaining a talented workforce. I think that to me is important. And then I would love to see our staff increase diversity of minorities at 1% per year if possible. I understand it's hard when you're kind of a all-white community to recruit those kind of people, or other people of color, I should say. But I think it's important, especially to the students of color, to have somebody here that looks like them. Also, it does help with student achievement, which is one of the goals that I think that we have going forward.
Questions for Amy? I see you have diversity staff to increase minorities at 1% per year.
Correct.
I guess I've always been a firm believer of hiring the best person for the job. Just my personal feeling on that one. So, regardless.
Can I just ask a question? So I understand, so Joe, you wrote it up, change strategies, deliverables, measurable goals. So I'm struggling as to the amount of investment that went in to create the strategic plan and the influence of community members and key stakeholders, et cetera, et cetera. So when we go and change, strategic plan, we're kind of changing what was stated and shared and rose to the top. And should some of these suggestions not be so much strategic plan, but could we put them more towards your measurable goals and maybe complement the two? I really struggle first starting to, so what was this point of us doing a strategic plan and getting influence if we're gonna now come this year and we're gonna change it and come next year and we're gonna change it? I thought it was a roadmap from that 2019 to 2024, so maybe you can speak to that.
Yeah, I tend to agree with what you're saying there, Tanya. There was a very rigorous process that we went through in terms of gathering feedback, analyzing the feedback. We had a team of strategic planning team that involved community members and staff members that went through an exercise with a consultant to try to identify what it was that were the highest priorities at the time. I will say that, coming out of COVID, there are some things that could be different, and certainly our world has changed in that amount of time, but there's a lot of unfinished business that we also need to focus on. So that is why I wanted to bring this to the board, to see if there was something that really stood out as needing to be addressed. But you're right, anything that's added would not have gone through that process. And that's not to say, though, that there are other avenues that we could look at to meet some of the desires of the board. And we, as an administrative team, we will serve the board and do what the board wants us to do. But, for instance, we do have the exit survey that all of our staff members take. I don't know that that would have to be included in this plan. We will have the calendar of board reports in June, and if the board would like to request a report on that, in a way it's almost tempting to put it in the plan because it would be easy to check that box, but I don't know if that's really the route the board wants to take in terms of getting into the plan, unless there's something that really stands out as being a glaring change since 2019 that needs to be addressed.
Amy?
Just to address both you and Tanya, I would be okay with that if it doesn't, if you're not putting it in the strategic plan. But I thought it was a place to start that conversation to put it there.
Sure.
So if we wanted to do like goals or things like that, that would be really helpful. So I could potentially agree with that. But like I said, I think it was just important to put something in there to start the conversation. Thank you.
Thank you. Chris?
And just because I spent a lot of time with that report and the data and the coding, those two inclusions that Amy has, not the one about sharing exit interviews, but certainly incident bias training, LGBTQ training, education techniques, and increasing staff diversity were a sizable portion of that feedback that I got. And I remember we went through some of the coding that Studer did that maybe was a little problematic, but most of it was really great. And I remember when you and me and Dan were talking with that Studer rep, And she's like, yeah, this is a starting point. It's meant to be, you know, not like flexible, but it's meant to add things as you go along. So this is a learning process. And it's not telling you that those ideas weren't part of that survey, they really were. And so this is actually bringing into that, you know, the pillars and strategies, some, you know, ideas that maybe didn't make it in. So they were this.
Traditionally, I would say that as long as the items that are being proposed to be added fit into the pillars, the action plan was a 1-year action plan for a 4 or 5-year strategic plan. So maybe the things that are being added are in year 3 or somewhere down the line. So that would be, I guess, my excuse for what I was thinking anyway. And the other advantage, I guess, to where I was going this month a while ago, but also with the new addition of ESSER monies, those monies could be used if there's any startup costs to creating an after-school kind of program. Those monies go away after a point in time. So if we wanted to use those monies for that, we could. I don't know. Someone may already have designs on that. I don't know. But that would be a possibility as well.
Could you speak to what your...
Sure. One of the things, I guess it was just a little bit less than a year ago, we were talking about some issues that had come up, and one of the things that I looked at was kids who are not achieving at level, if you will. And Brian did a report shortly thereafter and talked about socioeconomic need was really the primary driver there. And when I think about that, I think of maybe that sophomore in high school that's probably at home feeding his younger siblings because mom's working a second or a third job and some of those things going on, and they don't have the ability to get help with homework or maybe even time to do the homework, and that's why they're not achieving. Another thought would be when I looked at it originally, certain classes of students are more likely to be absent more often. So how can we help them not be absent, and maybe helping them to get their homework done and giving them a time where they can do their homework after school. I know when my children were little, there was a thing called the Ameritech Homework Helpline that we could call in the evening and get help. And that was a great thing for us as parents. And I know that there are some of those things that exist now, but I think having the ability for a kid of any status to go after school, to have a teacher there to help them with whatever they might be struggling with would, I think, greatly increase achievement, and I included a couple of pieces of information that would support that.
I like your idea. One thing that we do have is we do have a Boys and Girls Club that the board has supported student-to-student sports, which is for younger kids. But it does work, yes. There's, you know, this is I just came after I read the thing, this annual report came, and you know, it talks about Menomonie and all the different kids that they've served, and you know, all the things like that, which you're welcome to see if you like. I think I get it because I donate money every month to the Boys and Girls Club, just on my account. So I think that's really good. Also, I've been reading a book, and I just finished it actually, and I'm going to come up with the 9 or 11 principles that talks about how you can improve student achievement, and one of them is an after-school program. And the book I read was Diane Ravitch is the author, and the book is called Reign of Error, and it's a great book.
What was that title again?
Reign of Error, E-R-R-O-R.
Thank you.
Okay, and it's Diane Ravitch, R-A-V-I-T-C-H. I think she works out of the Brookings Institute that does a lot of studies, and she also has a blog. But the cool thing is this book has these cool ideas, and one of them to improve achievement, and one of the ideas is, you know, an after-school program, I believe. But one of these days, I'm going to type those up, and I can share those with Joe, and he can show me the word if you're interested. Good idea. Thank you, Charlie.
Is it safe to assume that it's not R-A-I-N? Reign of Error?
Diane.
What did you say?
I'm sorry, what did you ask?
I said, is it safe to assume that it's not R-A-I-N? Reign of Error?
Yeah, it's R-E-I-G-N. Yes.
Mark's trying to be fun.
Just clarifying.
Angie?
I think those are great ideas. I just wanted to add, Charlie, that I know at the high school level and at the middle school level, the teachers are very responsive to the kids because it's all, they're all connected via email and whatnot. So oftentimes my daughter will email her teacher and they're very responsive and very helpful to the kids on a weekend or on a night or on a school vacation or break, actually even, which is quite surprising, but they are. But I don't know, like young kids in elementary age, that's probably a little more difficult for them, and parents helping them do their homework. So yeah, I think it's a great idea.
And some of them may not even have internet, you know.
Yeah.
So would the board like us to draft that up as an addition, a strategic action deliverable by the end of the plan?
Aside from the Boys and Girls Club, do we have a program after school? Like, I think when my kids were little, it was like Jump Start, but that was through the rec department. Do we have something like that at the school?
There are some after-school offerings, but not like what we're talking about.
Okay.
Other than Boys and Girls Club.
Chris?
Like Charlie knows, I'm going to be a big fan of this one. So we did try to put together a program through Scout, and we did a grant, and we worked with the Community Foundation, and we worked with the churches that are doing the tables. There was a positive response with those guys, really trying to put together a meal and homework helping program in the afternoon. They had a really good model they called The Spot. That was at Price Lutheran when Pastor Randy were there. And those guys are really great. But they put together a small kind of model of what we're talking about. And one thing I like about Charlie's plan that he put together that was intentionally intersectional, that tried to build like different players that are part of our community that really, we want to start thinking about, you know, we all have a role to play in raising up, giving uplift to these kids that come from these socioeconomic backgrounds and these challenges. So a district plan for sure, but district leadership that brings together a whole host of people that it turns out people are already working on this. And after Charlie suggested the Boys and Girls Club last fall, one of the kids that worked on the grant that I was putting together, they actually joined the Boys and Girls Club and they had the best time, the best experience. And so this is like, especially hitting that middle school area where those kids are really struggling for the first time, where homework really becomes an issue for the first time, and getting some mentorship would be really valuable. And I know that I got a lot of positive support from Scout, who really wanted to build like a pipeline of course between, you know, our kids that want to be first-gen college students and working together with, you know, the people we have on the ground to make that transition, you know, an expectation. Not just that, you know, working in your minimum wage jobs is where you're going to wind up, but there's an expectation that education can build up your opportunities. So I think that Charlie is right, an intersectional approach is the way to go, and I think that this community is ripe to dig in and do some real work to really talk about those kids that have been left behind. So I support that.
So bring this back to the board on June 14th for approval.
Sounds good. Unless there's any objection? Okay. We move on to review student parent handbooks for 2021-22.
And this is just informational. As you know, you reviewed the high school handbook at our last meeting. Now we have the virtual handbooks, the Empower Learning Handbook, elementary handbooks, and the middle school handbook. Are there any questions tonight?
Okay, we'll move on to item E, board meeting protocols. This was asked or put on the agenda by Chris. So, Chris?
You know, there's a couple ways you can kind of address this one. I know there's been some back and forth, but Joe reached out to OSB to get some feedback in terms of what, you know, our protocols look like and if we follow Robert's rules of order and to what degree we did, if there's any problems implementing that. So, you know, just briefly, it's changed as it's gone along because I think the real problem is that we didn't follow what we normally do. And we changed like our general practice to try to achieve a specific outcome that has got long-term effects on how our board functions. And if we want a well-functioning board, you know, Robert's rules are important, but so is following the protocols that we've had, you know, at least since I've been around and since I've been watching the board. Some of the things that went down in the last meeting have never been done before.
Like walking
Normally people just flip people off. Involved in having dictators. But,
That's been done before.
not my best moment, admittedly. But there were some actions that happened that we really need to think about. Like, is that the type of board we want to be? We just had a board retreat on April 26th, and Dave spent about 45 minutes telling us the types of atmosphere that we want to have on our board. He said that we want to have a board that had debate, discussion, and dialogue. The question came up by me, shouldn't we always give people grace to finish their thoughts? And, Dave said, have I ever not allowed somebody the space to finish their thought? Actually, Dave has never done that until the last meeting. I said Amy's the only person that I've seen ever cutting off 3 minutes. But Dave had never done that before. I've never seen that happen before. And so what kind of board do we want to be? If we want to be a board that follows Robert's rules, if you're going to leave on the table discussion item, that means that there has to be a pressing need or an urgent need expressed to lay that item on the table. So I don't care if you want to kick my stuff to the curb, but there has to be an urgent or pressing need in order to apply laying it on the table. And when you just vote straight up and down, without ever explaining why it's so urgent that we table these discussion items, now you're not standing on board precedent, and now you're standing on Robert's Rules of Order. And I don't think we would have a problem if we just do the things we would normally do. Secondly, if you're not going to lay on the table to try to vote this down, then it's subjecting a minority interest to a majority opinion. And there, according to 43.4, you got to have a 2/3 vote. And I don't know, but I think Jamie took the tally on it. I think it was 5-4 on that one. But in any event, it certainly wasn't a simple majority. And so, thinking about why we're trying to adopt certain strategies that break long-standing custom of how we discuss ideas and how we share ideas to create, what Dave said was debate, discussion, and dialogue. When we decide not to do that, that creates long-term problems in terms of the well-functioning of our board.
Amy?
First of all, you can't lay something on the table unless it's already had a motion. Okay, in other words, if you're going through and let's say, you're, like for instance, the personnel consent agenda. If I move that we're going to move the personnel consent agenda, and somebody seconds that, that's the only time that you can say that no, we have other more important things to do. We need to table that and get a motion to table that. You can't table something that's not already on the table, is what I'm trying to say. And Margaret explained it pretty well, and I think she can, in her thing, explained it really well as well. Also, in 171.1, which we just approved, still has in it, it says, with approval of the district administrator or president, revisions to the agenda may be made 2 days or more prior to any scheduled meeting. No revision to an item may be made without the approval of the board member who presented the item. Okay, so that's really important to think about how you interpret that. Also, I think that, if something urgent, really the only time that you can change an agenda or dismiss an agenda item is something urgent is coming up. And I asked you what was urgent that we couldn't have discussed that night. That's all. And it would be nice to have a reason as to why it was, they wanted to table the situation. That's all.
I do have a question.
Angie?
So for clarification, kind of along the lines of what Amy was saying, when Tanya made that motion, it was right at the onset of the meeting where it says agenda order and approval. So is that not appropriate to do during that time where you set the agenda and then is that where we are approving it?
I guess in my opinion, that is the correct time to do it. The one thing I would say is that, hindsight's always really good. No board member at the time made a point of order to correct what we did. So I would, hopefully that answers your question. But Tanya?
Well, I think I'll two items. So to go back to answer Chris's question about what kind of board we should be, it would be wonderful if we can get back to agendas that have to deal with board issues. So the items that were requested to be tabled were all three things that didn't have anything to do with board. It was all admin administration. Nothing was, it was all operational. There was nothing that was provided by a committee. There was nothing that was establishing or amending any district policy. So I know when I ran to uphold policy. I ran to supervise administration. I did not run to bring directives of what committee Joe or the admin team should be making. I don't care, or I shouldn't say I don't care, if we have a policy that is already set that says when surveys are going to be, why do we have to go and create more? There's policy already there for those things. I would like to be able to know, Dave, do you feel empowered to say no to agenda items? Do you feel that the template is made that you can go and check and be like, oh yeah, this is a board thing, this isn't? And then will people take the criticism back that, hey, you know what, maybe this is a good thing, maybe I should talk in a small group, or maybe I should just go to Joe directly and try to work things out, or maybe go to a high school or go someplace else. But we need to get back to what we're supposed to be doing as board members, not pretending to be a staff or an admin, or I'm not qualified to do that.
I guess to answer your question, Tanya, I feel better with having the timetable on there, because when we get stuff in at 4:15 on Wednesday, and I don't happen to see it until 5:15, and it's not complete, in my mind, it really makes it tough to get things to Joel, and I feel that there would be repercussions as board president if I didn't put them on. So I think that having a new deadline helps, and I think having this template there is going to help a lot too, as far as filling it out. And if you follow the format of the template and put it in that way, I think it would be a big help.
Sure. Well, good to know.
Amy?
Just to address Andy's question about agenda revision and approval, the only thing that you can, Robert's Rules of Order will say this, the only thing that you can do in that time is you can only change something from a consent agenda to an action agenda to provide discussion. That's the only thing you can do. And you can change the order, and there's another thing you can do. You can change the order, but that only if it's like, for instance, like if Katie Gallagher only had a certain amount of time that she could speak, you might want to move her up or move her down, or whatever she had time to be able to talk to us. Those are the only two things that you can do. You can't take something off the agenda during that time. You have to wait till you get to that agenda item before you do.
Dr. Jones?
Respectfully, Amy, that is not at all what the attorney from the School Board Association said. And I think I put it in the background for you that, Robert's Rules of Order, the president and I prepare an agenda, but it's ultimately up to the board what is on the agenda. Just because someone requests an item does not mean that the board has to take it up. And typically in our district, the agenda has been approved through consensus. It's right there in the opening items, and the president will say, any questions about the agenda, and usually it's just by consensus. But if there are items that the majority of the board does not want to take up, there's nothing that requires the board to take those items up.
But yet at the same time, it could be for contentious reasons too. I mean, it could be that they just don't want to discuss it because they're not interested in it, or they don't think it's right. No, I will be fair to Tanya. I think she had made a fairly good point, and whatever. And if she had said that, maybe originally, that might have helped. But in my mind, I think that we broke some laws.
I guess my take is on it that I don't feel that as long as the board supports the decision that was made and is documented properly, Robert's Rules is pretty agreeable that way, that as long as the board supports what you're doing, that you're not really breaking the rules? Was there a better way to handle it? I think we all have really good hindsight that maybe we could have done a little bit differently. Maybe we could have explained things at the time, or we could have made a different motion, or some board members could have called a point of order and corrected a mistake that perceived that they felt that I had made, or something that was wrong. As far as the discussion portion of that meeting, there was a motion to suspend the rules. That motion failed. After that, at our board retreat, what I talked about and what I mentioned at our last board meeting was that each board member would have 2 discussion times up to 3 minutes long. And I asked them that if they were asking a clarifying question, to state so. And I talked about it again tonight. I also asked that board members help by policing themselves on this stuff. But Chris, to your comment about what was said at the board retreat, one of the things that you indicated was when I asked you about the 3rd or 4th comments, you said, well, I raised my hand and you called on me. And in my mind, you were admitting that I was making a mistake by not following what the board wanted to do. And so the motion to suspend the rules did not pass. Therefore, I felt that I was upholding the board's direction to limit discussion to 2 times each, and 3 minutes per time. And so that's what I did. But if, we've talked as a board that area, a lot of discussion on mask use in the district. And in my mind, a ton of clarifying questions were asked in the beginning. Once we were done with the health professionals that we had here, then people were making their own statements, and I considered those to be against their time, against their time for discussion.
In reading through this, one other thing I think would be helpful for the board, and I've worked with 5 different board presidents now in my 7 years here in Menomonie, and all the 5 board presidents have really tried hard to lead the board in providing a fair meeting, and that's the whole point of Robert's Rules of Order, is to have a fair parliamentary procedure. Now, that doesn't mean that everyone's going to get what they want. It means that the majority of the board, the will of the majority of the board, is what is going to rule the meeting. But one thing I think would help the board is, one, if someone disagrees with Dave or whoever the president is it incumbent on that board member to object, call point of order. And if you read, it's very clear in Robert's Rules of Order how you do that. And then, not only would you object, you would then make a motion to overrule the chair. So if you object and then the president makes his ruling and says, well, no, it's 3 minutes and that's it, you're done. Well, at that point, you could then say, well, then I make a motion to overrule the chair. And then if there's a second, then there would be a vote. So I feel like a lot of this, and Amy, when you were president, I know that you were critical sometimes too. It's really tough for the president, but at the same time, the president, Robert Rules of Order, yeah, I don't see that.
Well, just to your thing about point of order. That's why I had to go back and but I didn't know for sure. Something I didn't know. Maybe that's why I didn't call for it.
Yeah, I did do that. And so I just tried to make eye contact with you, David. On the first one, you explained to me what was happening. You said the vote was to table the agenda items. And then I said, what? And you said, no discussion, no debate.
Chris,
no.
Okay, I thought you were done, sir.
So that was the first one. So I asked my clarifying question, and you doubled down on a misuse, right, of your authority. The second one, You said your 3 minutes are up. And then I said, I just need 10 seconds. And you said, no. And then I said, you've never done that before. And then you said, that's the way it is. So 2 clarifying questions on your actions that were dismissed with presidential fiat. So I did what you asked me to do. I may not have said point of order, but I gave you the opportunity to address my issue with the execution, right, of both of those decisions. And you chose not to consider them. So how you describe that is not actually how that went down. And if there's going to be a misuse of authority to limit my voice, specifically and perhaps consistently, that's problematic. Especially if it's an issue that's concerning board oversight. Because that starts looking a little like a misuse of to prevent board oversight. And like honestly, that looks kind of corrupt. Now, if this is the one-time deal, that's okay. No problem. I respect everybody here. But if that's going to be a consistent way in which that you're going to use your authority, and I think I've raised this issue before, then that becomes a little bit problematic.
Joe, well, Charlie first.
Did any of you read the emails from the attorney at WSB? Did you understand the emails from the attorney at WSB? They were quite clear. I don't understand why we're having this conversation. Chris and Amy, you both tonight said that we've broken the law. Chris, you said it this weekend as well in social media.
It didn't say law.
Okay, a statute, sorry. I find that as someone who sits on a board would accuse the board that they sit on and accuse the district that they're representing of doing that without talking to administration, without talking to the board president, to say, hey guys, I think we got a problem here. I think maybe we might have done something wrong. I can't believe that. So I find it so ironic that you want to talk about board protocols and board actions when you're the one that's going out there and doing that. It's amazing to me that you would go there. I cannot believe that anyone would go there.
I'd be happy to respond to that question.
When I'm done, you're welcome to do so, if you have time left. None of your requests that were tabled met the requirements of Policy 171. I regret voting to table those items now, but that's why I voted for at the time. None of them met the requirements to be on the agenda in the first place. So they shouldn't have been there in my mind. That's why I voted that way.
That's your president. He put it on there.
Chris, please.
Robert's Rules of Order, we also have a policy that states, if we make a mistake on Robert's Rules of Order, that does not change what we did. So maybe we didn't do it correctly that night. That doesn't negate what happened. So I think we should try to just move on from this. And if you're going to ask someone, not the board president, why it was tabled, you ask the person that wanted to table it. That's the person that knows that they don't want to discuss it tonight because they don't feel we have time, or because it doesn't apply, or whatever the reason is. The board president may or may not know that.
Joe.
Did you want me to respond to that?
1 minute, please.
So, I'm not trying to get in an argument here, but I think you really missed my point, Chris. Yes, I do remember when you objected to David's ruling, which that was the first step But what I'm suggesting, not just to you, I'm saying this to everybody, so that we, you know, hopefully the board can not have these problems moving forward. That's only step one. It's incumbent on you or any board member who disagrees with Dave to then take step two, and that's to make a motion to overrule the chair. You did not do that.
He took a vote. It was done. He said, Jamie, take a vote. No discussion, no debate. Boom.
Chris,
Well, that's what happened.
go ahead, Joe.
I don't want to argue. It's very clear what is supposed to happen. And I feel bad for Dave and any other board president I've worked with for being criticized when it's incumbent on the board members to take that action, and that simply did not happen.
Chris, you want to respond to Charlie?
Yeah, so Charlie, when you were asking me to raise these questions before, that got curtailed in the second part of the issue. If you remember, I probably wrote like 10 pages of analysis of the problems that were involved in that particular question. And those questions weren't answered. So I was following through on due diligence to make sure that those questions were answered, to make sure that, you know, we as a board weren't putting ourselves in a position to be sued. Like, that's one of our obligations. So I've done a lot of work on that end to try and raise some questions that haven't necessarily been answered. Now, in terms of like, you know, my obligation to correct, you know, David's running of that meeting, I did. I tried. And in terms of like my obligations, like I fulfilled my objections. I might not have said like called question, but it's certainly called question.
Well, no, it wouldn't be called a question, it would be overrule the chair. Call the question something way different.
Fair enough. Okay, and I'm not saying that Dave is a bad person. What I'm saying is that we should at least acknowledge that something happened that really wasn't correct, and then we'll just move forward from there. What I'm hearing is that there's not an acknowledgement that there were some decisions that were made that compromised, you know, one particular board member. And I don't care about making a big issue out of this. If David's like, heck yeah, I see what you're saying, I'm never going to do that again, I'm good with it. I think I've reached out to Dave on another occasion to express that exact sentiment. And when, you know, Tanya, I totally appreciate like your commitment to try and follow like policy and practice. But like, you could have checked out how to do this. You know, what are the processes that are involved for tabling? Like, if you think my ideas are not worth discussing, I don't have a problem with that. You gotta do it the right way. And then you can't tell me, like, that the reason why, you know, you rejected those is because I wasn't following whatever protocol that I was supposed to, and that you not follow protocol to table those discussion items. It wouldn't bother me, right, to not have these items taken up for discussion. But how you do it, like, is really important. And then to use policy and point of practice as the means by which you want to say that, like, my, you know, agenda item should have been on the agenda to begin with, that was David's decision.
Okay, I asked you to respond to Charlie, and this is something different, so. Yeah, I have done, that Chris has done, Amy's done, Angie, Tanya, Charlie, all have one discussion. Anybody else that would like to weigh in on this?
I will make a small comment, and it is not related to Robert's rules. Some of us are on the board, what, that's our second meeting? We barely know what the hell's going on, right? And we'll learn, but when things don't go the way they should, it doesn't help us understand things better. And I will be very transparent that I felt very uncomfortable for two reasons. For example, there was an item, I believe, on dyslexia there. I can easily understand how treating or taking care of dyslexia is an educational topic. So I wouldn't understand why we wouldn't want to talk about that. And with no background on what the topic was, or why there was a motion to not talk about it, right? I had no idea what I was voting on, and that's a very uncomfortable place to be as a new board member. So that's literally all I want to say, is that I believe in talking about information, talking about ideas, thoughts, and And that put us new board members in kind of a funny spot, like, well, I don't know what's going on right now.
Any other discussion?
Quickly,
Charlie?
Carl, you hit the nail on the head. You didn't have any background on that issue because the background was not provided by the person who submitted the agenda item. Had it been provided, you would have known what that person wanted to talk about and why, and then maybe we would have, I don't know what the outcome would have been, but I suspect it would have been different.
Sure. And can I respond just?
Go ahead.
So for me, understanding why we had a motion to table that or whatever we did, that would have been helpful to me as a new person. That's all.
The background's in 5B. It was there last time we had a meeting.
Okay. Angie?
I guess as a new board member and learning the dynamics of what's going on and with Chris, from an outside perspective looking in, I feel like some of the things that you are or have proposed or that you become sort of crusade are things that aren't oversight for a board. Like we have people in positions in the district that's their job and we're oversight, and I feel like you get a little lost in the details sometimes, and even from watching past board meetings, you're contacting guest speakers, you're arranging things, which is kind of outside of the scope of the board, and so I feel that that's why I voted to support Tanya's motion, in case you're wondering. I mean, and obviously, I mean, I feel like we all, knowing what we know now, or had we done something different at the time, I mean, I feel like you would have done something different rather than got up and walked out, because obviously you do care, or you would not have gotten so upset. I mean, you're very passionate about what you're trying to talk about. And so I think opening the door to communication and going to those specific people would be preferred going forward, instead of going home and posting it on social media and that sort of thing.
Okay, I will say from my standpoint, when the motion came up, we did have a second. Part of that motion is there was no debate, and so when it says no debate, there's no debate. If even after we voted or before we voted, the board member had an issue with it and wanted to call a point of order, that would be the time to do it. Just going forward, so that we can make sure that if somebody doesn't feel comfortable with how we're doing, let's call a point of order and take a break and figure out exactly, is it right what we're doing, how we're doing it, or whatever. So, especially for the newer board members that might not understand, something that might be happening, it's a good point of reference.
I just realized I haven't used any yet, so I might as well talk some more, I guess, huh? Well, I did second Tanya's motion to table it for a couple reasons. It didn't have the material on there that supported what we're going to be talking about. Quite frankly, as president, I don't think I would have let it make the agenda, but I know you get second guessed all the time, Dave. The other reason I voted to second it is the person that was put it on the agenda wasn't here yet. So then it was kind of an awkward situation, because I had seconded the motion to table your stuff, Chris. Then you walked in, and if you look at the record, I actually voted to hear you out, because I listen to people that I disagree with all day. So I kind of wanted to hear what you had to say on it. However, I do think there's certain things that are, once again, not necessarily board oversight. It's more micromanagement of our staff and what our district is doing. But, had I had the supporting information, what direction you were going to go with it, I might have agreed with you and wanted to hear you out. So I'm hoping this template makes it easier, because it is a very tough decision. I'm kind of ribbing Dave a little bit too, but it is a tough decision for him to decide, do I let this get on the agenda or not? And, if he prevents the stuff from getting on there, and like Tanya objected to having it on there, I'll point that out again. If he objects to it, then you're going to be upset with the president for making that decision. However, the way it is, Tanya and I were upset with him for letting it get on the agenda. So we got a lot of stuff to do, a lot of stuff to talk about. So I want to make sure we're trying not to get stuck in the weeds. And I would have loved to hear what you had to say about it, but just make sure you got the stuff in on time to support it.
Okay, anybody else that has anything? Okay, thank you, everybody. We'll move on. Item 4F, review extracurricular staff contracts. They're there for your information. Any questions? We have 3.
And I just say they were huge assets to the middle school, the success of the track team. So very, very inclusive and, yeah, it was wonderful.
Okay, thanks, Tanya.
Yeah.
Okay, moving on to item 4G, review items related to next meeting dates, board committees, and reports. Our graduation is on the 30th of May, 2:00 p.m. Everybody knows who has to be there, right? I know I'm helping with diplomas. Who else we got? Amy, Carl, I think there's one more. Clint, there we go. Okay.
What time should we be there?
I'll email the people to be sure, but I was planning for a half hour ahead of time.
Okay.
So I'll email you the directions from Mr. Drake. Dave, also on this item about upcoming events, I know Amy had shared that she's going to be attending virtually the NSBA Equity Symposium, and Amy, you wanted to invite any of the board members, I think?
Yes, I just, since we don't have the board superintendent communications, I wanted you all to know that I can sign up for that, about equity, and I think that's something that is like national-wide, you know, talking about equity, and it sounded like it was really good. It's a 2-day workshop, and it's all virtual, and it was pretty inexpensive for the district, and it's $125. And so I'm going to be doing that, and if anyone wants to do it, just go ahead and sign up, and Jamie can help you.
It's on July 13th and 14th.
Yeah.
Thanks, Amy. Okay, now we go down to table discussion items. Anything that anybody has on those? Okay, I'll take a motion to adjourn.
I'll move to adjourn.
Charlie, is there a second? Tanya, all those in favor signify by saying aye.
Aye.
Opposed? We stand adjourned. Thank you.
Oh, before you guys leave, some of you came in later. I wanted to introduce you to Janet Quinn. She is going to be my new assistant after Jamie retires in June. And it is, yeah, that's awesome. Janet volunteered to come in to train with Jamie tonight, and then our next board meeting, I think she's going to run it, and Jamie's gonna kind of